I lost access to my compounded Tirzepatide, these are 5 things that I would do as an obesity medicine physician. My name is Dr. Lindsay Ogle. I'm a board-certified obesity medicine physician, and I have seen this happen to several of my patients. They were doing wonderful on a compounded Tirzepatide, and it was the most cost-effective option for them. They felt great on it. They were losing significant amount of body weight. On average, we see 20% body weight on Tirzepatide, but unfortunately, the courts ruled that compounded Tirzepatide is no longer legal to produce because we have adequate supplies of the brand names Mounjaro and Zepbound. This is devastating for so many people and many of the physicians that prescribe these medications to patients. We hate seeing patients lose access. That's never our goal. We want what is best for our patients. We want to see our patients healthier, and many patients get healthier on Tirzepatide, whether that is because they have type 2 diabetes, which Mounjaro is FDA approved for, or if they have obesity, which Zepbound is FDA approved for. But these medications are not covered by all insurance, and they're very expensive, typically around $1,000 a month at the pharmacy for brand name options. And so for millions of people, compounded Tirzepatide was the option that they were utilizing, and now that is gone. So I wanted to share with you what I would do if I were in that situation. If I were getting my health care through my employer or my spouse's employer or my parents' insurance, I would write a letter or reach out to the HR department of that employer, because oftentimes it is them that decide if they are going to include anti-obesity medications in their insurance package, because insurance is not required to cover treatment for obesity, even though obesity is recognized as a chronic medical condition. It's been recognized by the American Medical Association since 2013. Insurance doesn't have to treat it. Hopefully that'll change with a lot of advocacy work that is going on, and I will include links below to how you can, to a few organizations that are doing an amazing work, and you can join them, and please join them. But I would also reach out to my HR department and see if they would consider adding on anti-obesity treatment into their package. And share your story if you feel comfortable. Talk about what improvements you've had. I think it'd probably be a good idea to include how much more productive you've been as an employee, because that is what your employer will like to hear and may tip the scales, may not, we'll see. But think, what would my employer want to hear? Why would they want to invest in this? And include that. So number 1, I would probably look at my budget and see if I could afford Lilly Direct. What is Lilly Direct? So this is getting brand name Zepbound from Lilly delivered to my house. So it's super convenient, and I know what I'm getting. I know it's safe. I know it's effective. It's the same medication from the same, production company that I was getting before. The only difference is, instead of a pen, the auto injector, the auto injector, which is really nice and easy to use, it comes in a vial. But the vials are single-use vials, so you will only have 1 dose in each vial, and the needle is still very, very small. And you'll get all the instructions on how to do it. It does a couple more steps than the pen is, but it'll be straightforward. And if I had any questions, I would ask my doctor for some guidance on how to do the injection. Number 2, the other thing I would consider would be seeing if my doctor would send a prescription to a Canadian-based pharmacy, where medications are typically less expensive, and these could also be mailed to my house. It's probably going to be more expensive than Lilly Direct, but it's another option, and you may be able to get the pen if this is something that's really important to you to have the pen. that could be an option of still getting the brand name, the same medication that you were getting before. And always remember that, especially when you're not using insurance, you have more authority. You can have more choice because you're paying for it yourself. You can switch between Mounjaro and Zepbound. They're the same thing. They just have different FDA approvals. And so your insurance will only cover Mounjaro for type 2 diabetes and Zepbound for obesity, but you can use it for either. They're truly interchangeable. The third thing I would do would be consider bariatric surgery. Many people think of bariatric surgery as a last resort, and I really hope to erase that from the general consensus. Surgery can be an amazing option. Of course, something that you want to get a lot of information on, understand your risks and your benefits. It is something that can be extremely effective for the majority of people. So if you qualify for bariatric and metabolic surgery, and that is typically a BMI of 40 or greater, or a BMI of 30 with type 2 diabetes, or BMI of 30 and you've tried medications and lifestyle and have not reached your health goals. So metabolic and bariatric surgery may or may not be covered by your insurance. You definitely want to look into that, and most bariatric centers will do that work for you. Consider it as an option. Honestly, especially if you've done well on compounded Tirzepatide, because the more we understand how metabolic and bariatric surgery actually works, we realize it's less about constricting the amount of food that you're able to eat and less about the malabsorption that is caused from certain types of surgeries, and more about the hormonal changes that occur because of the surgery. And those hormonal changes are very similar to how the medications work. So in a gist, it's like having a surgery form of the medication. So you have it all of the time, indefinitely in the future. And so it's a great option and something that you should definitely consider. Number 4, if I had been on compounded Tirzepatide for a while and I'm pretty close to my goal, or I'm at my health goal and I'm really just maintaining at this point, I would strongly consider trying an alternative anti-obesity medication. One that is typically not as effective as Tirzepatide, but may be just what I need for maintenance, and it'll be a lot less expensive. Examples include phentermine, Qsymia, and Contrave. I will include a link here to a video where I talk about all of these options, and they're great options that either your primary care doctor may feel comfortable prescribing, or finding an obesity medicine trained physician for guidance on those treatments. And then number 5, compounded semaglutide is currently still available. So I could consider transitioning to an equivalent dose of compounded semaglutide. The reason that's number 5 is because that option may also go away in the next couple of months. We don't know. The other options are much more sustainable, especially if you're somebody who does not like uncertainty. Options 1 through 4 may be better. But if cost and effectiveness are at the top of the list, then compounded semaglutide may be a good thing to transition to at this time. And who knows, maybe we'll have that available longer term, which would be great. And last, please hear me when I say this. I am not trying to be trite. I understand how hard you have worked. None of that is in vain. It was not only the medication that helps you improve your health and get to where you are now. Of course, the medication is powerful and it was extremely helpful. But you have done so much to improve your health. Please do not stop now. Your nutrition plan, your physical activity, sleep, stress management. Please do not throw that out the window if you lost your compounded Tirzepatide. If you continue to do those things and stop taking medication, it is likely that you'll gain weight. That does not mean you're doing anything wrong. That means that your obesity is not being treated right now. But continuing to do those things will help maintain your health, your metabolic health, until you are able to treat your obesity again. And I do believe that in the next couple of years, insurance will be required to treat the disease of obesity. It's going to take some time. That is why the advocacy work is so important, and we will get there. I believe that you'll be able to have your medication again. I truly, truly do. So do not give up. Keep taking care of yourself. It may require working with a dietitian, a therapist, a trainer, an obesity medicine physician. Surround yourself with that support and take care of yourself during this time. I wish you nothing but the best. I wish you a long, happy, fulfilled life, and I'll see you next week.